Sally, thank you very much. And can I just echo that a warm welcome to everybody who's been able to join us this afternoon for this particular session. You may know this week is also co-production week, and I'm sure issues around co-production will be coming through the whole of this happy hour this afternoon. And it's something that's very much at the heart of the work of TAPPI, the Technology, Our Aging Population, and the First Inquiry Panel for Innovation. We've got a great lineup for you, and we couldn't do this without the support of Tunstall Healthcare this afternoon. So Angus and Ian, can I personally thank you and the team for your ongoing support of the HousingLIN. And can I also just also send some acknowledgement both to the UKRI and Dunhill, who are also supporters of the HousingLIN, and thank you for that. But we do have a programme that's going to look at technology, and we're going to have a series of short presentations and discussion and Q&A this afternoon, because actually issues around technology are very prevalent. You know, only last week I chaired a session at the Chartered Institute of Housing conference on this, and again, issues coming through around technology, in particular around the built environment, were very prevalent, and also the Department of Health Social Care, along with NHS partners, published their digital plan for health and social care, and I'm sure Mark, Angus and others may touch on some of that during the course of this afternoon. Up on screen at the moment, you've got this afternoon's programme. We've got four brilliant speakers: Sue Kay from the Tunstall Medical Trust, and she's their Chief Executive; Mark Brown, Head of Housing and New Models of Care at the Department of Health, who's worked tirelessly behind the scenes and in fact front of house as well in many occasions on issues relating to the adult social care white paper and embedding housing matters within that. And last but not least, Angus and Ian from Tunstall Healthcare, who are going to sort of share with us some of their vision, but also walk us through some of the questions that we want to sort of discuss with you and others around this. So you can see we've got a fairly interactive session this afternoon, and please do, as Sally said, put any questions that you have either for any of the speakers directly or for us to discuss in the Q&A box, which you will find at the bottom of your screen. And if you so wish, please do use the Twitter handles here to tweet on, use your social media profiles to share any information that you feel is most relevant that may come up from this afternoon's discussion. So thanks very much for joining us, and it gives me great delight to introduce Sue Kay, Chief Executive of Dunhill, and you know, really the person behind the scenes is making TAPPI move. So over to you, Sue.
Thanks, Jeremy. I think there's more than just me that's making TAPPI move, but thank you for that. There's a whole great team of people working on this. This is just a short presentation. Some of you here today will have heard some of what I've got to say before, but I think it is worth repeating. I hope it's worth repeating. Just very briefly, for those of you who don't know us, we're an independently endowed charitable foundation whose charitable objects are focused on researching the mechanisms of ageing and improving health and social care for older people. We distribute about £5 million a year in grant funding, but we collaborate with others to enable us to do more than that, and to use our investment portfolio in support of our wider mission. Unsurprisingly, right now, one of our key areas for focus is around addressing some of the social factors that determine your health outcomes later in life. And so we've been supporting some really great work in the development of age-friendly housing and communities, and focusing on the inextricable link that's been demonstrated over and over between housing, health and social care. The great privilege, and I use the word advisedly from long experience in both the public and private sectors, joy, in fact, of working for an independently endowed foundation, is that we're in it for the long term. This means that we can work unconstrained by annual budget setting and settlements and reflect the long-term approach in our work. And if there's a topic that ever needed a long-term and, dare I say, dogged approach to change and delivery, it's addressing the housing, health and care needs of our ageing population. Housing, health and care are complex sectors. Why? Because they straddle the public, the private and the third sectors. They involve people, land, rapid technological change and money. Spending from one organisation's or department's budget will result in substantial benefit to another. We've lived in some very interesting times over the last more than 2 years now. but I'm noticing some signs of some positive movement in addressing some long-standing wicked problems at both the policy level and in communities. And we think that the time's right to really capitalise on that progress, that enthusiasm and energy while it's there. Sally, can I just have the next slide, please? As someone who's spent some years working with engineers, I know that to address complexities, a whole systems approach is needed. And that extends to how we operate as a funder. We've done some really hard thinking about what we can do, given our relatively limited resources, to best support the radical change that needs to be achieved. In recent years, in the community-based programs we've funded, we've seen some success in taking a sort of a two-pronged approach. That is supporting the research and gathering the evidence and identifying the right people and organisations who can use this to make the case for change at the highest policy levels. But we also like to support frontline practitioners to demonstrate how change can actually be achieved through the provision of catalytic grant funding, encouraging partnership working and co-production. That's really important in co-production week, and a willingness to collect the practice-based evidence and share it with peers, so you get the ground-up demonstration of achievable change. And this is the approach that we've taken with two major pieces of work we've funded recently. The Technology for an Ageing Population Panel of Innovation that Jeremy just referred to, or TAPPI, in partnership with our friends from the HousingLIN and now the Tech Services Association. And the Commission on the Role of Housing in the Future of Care and Support with our colleagues from the Social Care Institute for Excellence. Colleagues from the fantastic stakeholder organisations who are involved in both of those programmes, and there was a really extensive group of people, anyone who's anybody in housing, health and care, really worked hard to publicise the work, and we've seen many of our recommendations and findings reflected very strongly in the Social Care White Paper, People at the Heart of Care. In both of these pieces of work, we set out to reflect on the current context and what it's taught us, to focus on understanding why it's been so hard to do anything tangible and radical about it, and then explore how we could address the challenges. What did we do? Well, it wasn't rocket science. We simply looked at the problem from a different perspective, from the other end of the telescope, if you like. We talked to the people who draw on services, which again is very apposite in co-production week, and applied the practical and doable filter. Have the next slide, please, Sally. Just alighting on the work of the Commission on the Role of Housing in the Future of Care and Support for a minute. The commissioners were a range of leaders, as I said, from across the health, housing and social care sectors. Didn't set out to say anything new. It didn't need to. There's a ton of evidence and research already out there. We largely have the answers. What we need is the will, and in some cases, humility to get on and find ways to deliver. The report set out a roadmap and recommendations for what needs to be done in the short, medium and long term. And I'm not going to go into that now because I think we might be touching a bit on that in the Q&A later. Can I have the next slide, please, Sally? If you really want to make change, you need to engage communities and those delivering services to demonstrate that it's possible and practical. Helping willing communities to just get on with it, to pool the resources, to share experience, access any additional public funding that's made available, and most of all, ensure that it's well spent. We've been really impressed over the years by the approach taken by our friends at the HousingLIN on the development of the HAPPI principles. So in the summer of 2020, with the expert leadership of the team at HousingLIN and our chair, Roy Sambach, we set about collating information, intelligence, and most of all, examples of good practice from across the tech-enabled housing and care spectrum and from across the UK. And at a time when everything relied on the tech working to get it done, and everybody was learning a new way of working, it was really inspiring to see these changes embraced so speedily, with such good humour and to such good effect. And in the spring of 2021, we published a draft set of 10 TAPPI principles and big insights. Could you put the next slide up, please, Sally? Like the HAPPI principles, the 10 TAPPI principles firmly put people at the centre of decisions about design, the people who are experiencing the challenges that the services and products are intended to help. So it didn't look at the problem from the perspective of any particular sector, it looked at it from the needs of the people. Co-production needs to be at the heart of everything to effect that change. Could I have the next slide, please, Sally? So that's why we launched our follow-up programme, or HAPPI 2, at the end of March this year. We've committed £1 million of funding to a 12 to 15-month programme that will see our expert delivery partners, HousingLIN and the TSA, supporting, well, I say 4 locality-based demonstrator sites. Actually, we had so many great applications for this scheme that we're hoping that we can extend it. So at Dunhill, we're just sort of looking behind the sofa for the budgets at the moment, and we really hope to be able to expand that. We want to evaluate the principles' usefulness and their usability, and to share that learning in the hope that this will encourage and support others and provide the evidence and comfort to those responsible for turning policy into practice need. We were agnostic about the kinds of technology that are going to be tested as part of this programme, and we wanted to see a mix of urban and rural environments, support for independent living in privately owned housing, and to supporting housing with care, so a whole spectrum of contexts. The findings of the Commission on the Role of Housing in the Future of Care and Support uncovered a real need for a range of housing options in every community, and we think that technology has a big role in enabling that. But what we want to do is to see a laser focus on improvements for older people through introducing technology solutions, some concentration of the issues or challenges that might need to be overcome, and I think we'll probably come to that later as well, and finding solutions and a real desire to share the learning and support with others along the journey. So last slide, please, Sally. So I've got a little bit of an announcement to make today. Some of you might have seen it on social media already, but we wanted to appoint 2 additional partners to come along on this journey with us. Pete Fleischman and colleagues at Co-Production Works have been selected as our co-production partner. And their proposal really demonstrated that they shared our goals and had the experience to deliver them. We're really very much looking forward to working with them and with our evidence partner at the University of Cambridge, and all of the demonstrator sites, which, as I said, we're hoping to announce very shortly, and to really learn something very quickly over the next 12 or 18 months, that so that we can really see this change in tech-enabled care really start to gain some momentum. So that's all I really wanted to say for the moment, and I believe I'm now handing over to Mark, is it?
Yeah, that's right.
Yeah,
Thanks, Sue, for that real great introduction and overview. And it's such great news to hear about the launch in relation to co-production works and the work at University of Cambridge. I'm sure they'll be great allies in this process. So, Mark, we've heard a little bit about the research and testing some of this out. You're going to share with us some insights from the policy perspective. So, can I hand over to you?
Yeah, thanks very much, Jeremy, and good afternoon, everyone. So I'm Mark Brown from the Department of Health and Social Care. I work in the social care group, and the team I lead is our housing and new models of care team. So frankly, it's an exciting time to be in the group with that job title, to be honest. Susan has already trailed our adult social care white paper, People at the Heart of Care, which was published back in December. Lots of the headlines, lots of the sort of media focus inevitably is about charging reform and how we ask people to contribute towards their care. But the white paper really sets out an ambitious programme of system reform, a 10-year vision for reform, and some very concrete steps and some very concrete investment over the next 3 years to take the steps towards that. The starting point, I think, for talking about housing and technology is in the vision of choice, control and independence, which the white paper sets out. Essentially the idea of enabling people of all ages to live and to live well behind their own front door. Essentially, when you speak to people, that is very often their stated preference, whether that is in specialist or supported housing, more mainstream housing, their current home that they might have been in for years or decades, or a new home. And the white paper sets out a much stronger set of commitments and ambitions, and indeed investment around housing and technology than we've seen previously. And I think that's really important. But the most important point I would say is that the narrative in the white paper is about those elements coming together, the fabric of one's home with the tools, digital or otherwise, and the people around you coming together to help you live well. And when we speak about housing, for me, it's really about not just seeing the bricks and mortar in isolation from those digital solutions, or indeed in isolation from people. I could give a quick greatest hits of the funded commitments in the white paper. There's £200 million to continue the cash programme of capital subsidies, over 500 million a year for the disabled facilities grant, with an ambition to better use that for a wider range of digital solutions. £300 million to boost the supply of housing with care and support. A total of 60 million for innovations in models of care and support, including for unpaid carers, and 150 million pounds for tech and the digitisation of the sector. And as Jeremy says, it's well worth having a look at the very recently published digital plan for health and social care, which pulls together, I think really usefully, pulls together a range of strategies and plans coming out of the DHSC into a single vision and narrative in one place. So that's really useful. I'll just finish by making a few remarks about that £300 million housing investment in particular. We have the task of standing that on its feet over the summer and autumn, and beginning to invite bids from local places towards the end of the year. Now, a really key objective of that fund and part of the delivery model is about supporting local places to build some really strong, mature partnerships, strong evidence-based strategies, conducting needs assessment, putting investment plans in place, because we know that when you look at those local places who are really making the headway on this agenda, that's what they all have in common. That's what really drives change, attracts investment, and I think really gives partners the confidence, not just to pilot innovation, but to really embed that into the business as usual. So that's going to be a really important part of that fund. And indeed, part of the fund is also about pushing some of the more mature systems that already have those well-developed plans to really go further. We've, in recent months, been doing some nuts and bolts behind the scenes stuff to do all that really robust work you need to do to get permission to spend public money. So that necessarily has been happening a little bit below the radar. But in the next few weeks, we're really going to be ramping up our engagement with local places, with local authorities, with housing providers and other partners, really ramping that over the summer, and just sharing more about the opportunities that are coming down the pipe, and how you and your partners in local places can get involved and access some of that funding. So watch this space. I can say a little bit about that today if people have some questions, but watch this space, and there'll be more opportunities to learn more in detail about that fund coming up shortly. And as I said earlier, it's really about bringing together the fabric of the housing, what's in our homes, whether those are digital tools or more traditional prosaic tools, with people, whether that is the users, those who draw on care and support, with whom we want to co-produce some of these solutions, or indeed the communities, the friends and family amongst whom they live. I'll pause there. Thank you, Jeremy. I hope that's a helpful bit of context about the DHSC's plans.
No, thanks ever so, Mark. I think it's a very helpful reflecting back the last 6 months in terms of the white paper, some of those critical investments, planning, system change elements that you want to do, but also a taster of what to expect in the coming weeks. And I'm sure there will be some questions, but I know from some of the sort of conversations we've been having with the sector, they're really keen to sort of look at how they can adapt and implement some of this as well. So that's great, and I'm sure we'll come back to that shortly. But I'm going to welcome and introduce Angus Honeysett and Ian Thompson from Tunstall. You've both got vast experience around marketing and sales. Both. I think Angus, you're going to kick off, and then we'll come to you, Ian. Okay.
I am. Thanks, Jeremy, and good afternoon, everybody. So as Jeremy has introduced, I'm Angus Honeysett. I'm Head of Market Access at Tunstall, and joined by Ian Thompson, who's our National Sales Manager. So I'm sure that many of you on the call will know Tunstall, but those, if there are any that don't, we're a manufacturer and supplier of housing, social care and health technology services and solutions. Should you want to talk to us, we'll be more than happy to take conversations with you. So my vision for housing, health and social care starts with knowing that there's a crisis due to an aging population, and that between now and 2040, it's predicted there'll be an extra 6 million over 65s. Now, I'm sure you're already putting in place things that will enhance people's care for longer, but we need to think about and add technology to people's lives to assist with keeping them out of the care system. And however the aging population is at the forefront of everybody's mind, irrespective of housing, health or care, housing plays a fundamental part in supporting citizens with their health and care needs. Now, Sue's already talked about the 10 HAPPI principles, and these set the scene that housing plays a fundamental part in supporting health and care needs, whether that's through co-production, i.e. involving people to co-create solutions, cost effectiveness, offering value for money, being person-centered, and that's putting citizens first and giving them control over their environment, care and support needs, or prevention, where we are focused on preventative models of support rather than reactive ones. They're just a few examples of where the HAPPI principles can apply, and of course there are others, and all of which are hugely important. And that leads on to the importance of integrating housing, health and care, and the need to get on with it. Simply, we've got to do it rather than continuing to talk about it. Working together is in everyone's interests, with the key word being integrated. A large part of the population have both health and care needs, and it makes sense to join them up at home where they want to be, saving the taxpayer money. My passion is for a truly joined up, integrated housing, health and care systems where citizens live well and live longer in a place of their choice. At that point, I'm going to hand over to you, Ian, to introduce yourself.
Oh, thank you, Angus, and good afternoon, everybody. It's lovely to hear there are so many people joining us for the call this afternoon. I'm fairly new to Tunstall. I've been with the company for 8 months, but I have a long heritage in health. I worked for a global vaccine manufacturer for 25 years, and their ethos was very much around prevention. And there are so many strong parallels whilst coming over to Tunstall I see now, because a lot of the technology we're using really helps to prevent accidents. It prevents situations that can cause the frail and the elderly to have an accident that may well mean the end of their living independently. It might be the accident that moves them into care. It might be the thing that takes away that independence from them. So it's been a lovely transition. And I think it's really, today we're looking at things like, it's all about population health, housing and care, working together to put the citizen at the heart of decisions made about them and their care. Of course, all three are dependent on each other. If we don't do a good job with care, citizens will need the health system. And if we don't keep citizens well, it will have an impact on housing. We need to have a truly joined up, integrated approach. But most importantly, we need to listen to citizens, understand their everyday needs and work together to bridge gaps, whether it be in health, housing, or indeed care. Technology has become an accepted norm at home, especially during and post-COVID, where our industry achieved and maintained high levels of service delivery through extraordinary levels of dedication to our customers and users. Gone are the days of technology being all about playing computer games or being for the young. It affects all of us every day. We need to make sure we're using it effectively. We need to believe in the connected world and the value that can come from technology solutions, both socially and financially. Aligned to this is the importance of standards and security. Our life-saving technology-led services and equipment must be standards-based, cyber-secure, resilient, and future-proof. We need to make sure citizens are at the center of everything we do, whether it is through early intervention, improving their well-being, or increasing their interdependence and that support, including technology-based support that should be delivered at home wherever possible. As citizen outcomes are improved, it has a direct positive impact on care and delivering cost efficiencies for primary, secondary, and social care. For example, improved condition management and medication compliance have a clear impact on decreasing GP visits. Clinicians are able to target patients that need support rather than those that just need to be monitored, and early intervention can prevent future, often high-cost care and support being required. Using technology to support people at home is low cost. This means citizens can stay home for longer, increasing their quality of life. Likewise, relatively low-cost telecare or telecare systems can help avoid hospital admissions, delay and prevent the need for residential care, and reduce career burnout. It's about working in partnership with housing, ICSs, local authorities and commissioners, understanding what is required and adapting as things change, not to be driven by contracts, but in providing solutions. We need to go back a stage before solution building. If we understand what the problems are, we can help co-design the solution. It's a bit of, don't tell us the solution you want, tell us the problem you have, and let's come up with the best solution together. But it's difficult. Technology historically has been seen as a barrier. Cultural change is required, which in turn needs early engagement. We must lead from the top to ensure stakeholders have input and at an early stage into how technology can help them and the citizens they support. There is still fear that needs to be addressed. Stakeholders need to know technology is an enabler to help them, not to replace them. But we have some great opportunities: the move to digital, the chance to use predictive and preventative solutions in place and to work together collaboratively. We can drive our sector in moving from being reactive to delivering high quality proactive models, enhancing outcomes for citizens, improving efficiencies, and redesigning services around the user. AI, machine learning, and the use of data are hugely important, but we need to educate people to understand the value of data. People getting value in return for providing their data, all of which enables us to come up with more creative solutions. Thank you.
Ian, thanks, and Angus, thanks both of you. A great double act there, and I think both of you have touched on several things, both in relation to prevention, but also, as I think Angus, and following up what Sue was saying, that personalisation of services, both through HAPPI, but also, as you say, Ian, that digital citizenship as well. So that's really helpful. I'm also pleased you mentioned ICSs. Many people don't know ICSs, or the acronym ICSs. For those of you who don't know, these were sort of statutorily introduced some time back, but formally came into being last Friday, integrated care systems. So again, how to forge greater partnership working and to create those duties around collaboration at a local health and social care economy. And again, while housing may not be regarded as explicit, it is implicit in that. So no, really important. I know we've got a couple of questions and comments in the chat and Q&A box, and I think Ian, you may have answered one specifically from one of the HousingLIN members. But you talked about barriers and cultural barriers in particular, but I was also wondering what other barriers you might think there are in relation to sort of integrating technology more effectively across housing and social care, because if we're going to support Mark to make those system changes, it may need more than just the culture. And I know Mark's got this 300 mil, which is hopefully going to support some of those sort of transformation taking place. So I was just wondering whether there's any sort of insights you've got around some of those sort of barriers in terms of integration.
Yeah, I think things like, digital inclusion and quality. How many homes don't have currently access to the internet? Simple things like the investment and funding that Mark was touching on, and in the future improved digital infrastructure. Who's responsible for it? Where does that responsibility sit? A lot of the housing stock we have currently isn't perhaps ready for technology. Do we need to think more about designing homes that are more care ready? I think COVID has exacerbated the digital divide, and some of the other challenges around sort of data sharing, the value that we'll be able to extract from data, which is rapidly increasing, is as yet really probably untapped. And then the interoperability challenges, how we need to rise to these challenges, because I think the more we rise to them, accept them, the better the quality of life for our citizens, and the less cost implications across all of the agencies. So the more we work together, the more I think ultimately we will achieve.
Yeah, I think you picked up a number of really important points there, both in terms of sort of the digital inequalities that exist out there, which could prevent on a personal level, but also some of those system changes that are needed. And again, to support that sort of transformation. And I think you talked about the redesign of services around the person. And I see that being very essential as part of hopefully what will be this transition, the transformation that sort of, and the innovations that Mark was touching on, which hopefully we'll hear a little bit more about in the coming weeks. But you also picked up on our existing stock. So this is not just about new build, it's also about how do we make sure integration. And again, I was pleased that Mark reminded me at any rate, and I know we've got a couple of OTs on the call as well, that this is equally important for retrofitting our existing homes and the role of adaptations, community equipment services, the use of the DFGs and the like. So that's really important. Before I move on, do Sue or Mark or Angus have any other comments they would like to make, just picking up on what Ian was talking about?
Yeah, I think I would. I just wanted to pick up on this, the business of educating users. I think it's not just educating potential users about the power of technology, and I know this came up in when we were doing the work coming up to the HAPPI inquiry. But there's education needed at every level. There's education needed amongst professionals about the power of technology, what's actually out there. And a lot of professionals themselves said that they felt underconfident around that. And then there's also about education in procurement. I think that's a real issue as well. So it's kind of education at every level. We tend to think about this sort of nebulous group, these older people who are fearful of technology. But actually that's not true. It's not true across the board. And we were hearing that from the proposals that we had in from, our co-production partners. It's not true, but there are other gaps that in education and training that really do need to be addressed. And that's on the supply side too.
Yeah, so it has implication for the workforce as well, as you say. Mark, I think you've got your hand raised.
Yeah, thanks, Jeremy. Just to make a very brief comment really about barriers. I mean, one of the things that we want to do with the £300 million investment in particular, but also some of the other funding, is I think give local systems the space and breathing space and headroom to get into some of these issues and to have some of those kind of considered local conversations. And especially in a period of really sort of dramatic reform of the adult social care system, we recognise quite how many demands are being made on local authorities and local partners, and the support that we might be able to provide, financial and otherwise, that gives local systems that the headroom and the breathing space to get into some of this stuff, I think, I hope will be very welcome, and really recognising that if you try something new, if you want to make a change, that carries risk, and a way of helping local places manage those risks of financial risks and capacity risks is part of what we want to do. I'm not going to presume from my Whitehall Ivory Tower to tell people what the solutions are, but part of the conversations that we want to be having over the summer is to ask local places, help us design that support offer so that it's giving you the support that you would like to access. Thanks.
And presumably you're also asking the risks, not just all risks that work well, but what are the risks that, what can we learn by failure as well? So, sorry, Sue, I interrupted you.
No, I think that's really great to hear, because when we were calling for proposals for the 6 demonstrator sites for 4 to 6 demonstrator sites for the HAPPI work, we really wanted to get people thinking about what the challenges would be and how they could overcome them. So things like the things we've been touching on around data privacy, cybersecurity, those sorts of things that actually people feel very sort of, it's on the too difficult pile at the moment, but a real chance to explore some of those issues. So we're hoping that they're going to be incorporated in that learning from the demonstrator sites as well. So I think that'll be really useful input, hopefully, to the conversation that Mark and his colleagues are going to be having.
So, I mean, so taking that forward, I mean, I think, we've already started touching on sort of thinking about what at a local level is required, what the system changes, the leadership, the style, what are sort of, how can we improve some of that partnership working between the various stakeholders? And are there gaps already that we can help plug in terms of that, in terms of cross-housing, health and social care?
Shall I take that one to start
with?
Yeah,
please.
So, and I think colleagues have already mentioned sort of some of the things that we can do with partnership working, and a lot of it is around collaboration. It's about working together. And Ian, you referred to not talking about the solution you want, but let's hear about the problems you have and work on the best solution together. And that for me is sort of true collaboration. It's understanding that you've got a challenge in this area, but actually, the solution might not be obvious, but let's work on understanding that problem and coming up with that best solution together. And an element of that is all about working in sort of an MDT type way. So it's the whole system. It's housing, social care, health, voluntary sector, technology providers, and citizens working together. And we often forget about the citizen being at the centre of everything. And at the end of the day, that is the person that we need to support with all the solutions that we provide. But then, Sue, you raised an interesting sort of point in the answer to the previous question, which is about supporting the workforce and citizens in terms of cultural change and digital skills and education, and engaging at all levels, not just from a top-down approach, but sort of technology and housing and social care. All this stuff needs to be everybody's business, not just the Department of Health and Social Care, not just Dunhill, not just HousingLIN, not just Tunstall, but everybody, because it affects everybody, no matter where you are and where you live. So picking up on the sort of the benefits of doing that, you're going to end up with sort of tailored and citizen-focused solutions. We're going to be keeping citizens at home rather than hospital or care that requires expensive support. And if we don't do this sort of work on develop partnership working, it's going to lead to fragmentation of services, a lack of coordination and gaps in care, which will then need the system to come in and say, well, actually, there's a gap in that care. What on earth do I do about it? And then you sort of then build up this fragmented approach again. So collaboration and working together, I think, is hugely of value. I'm not saying it's easy, far from it, but we need to get better at doing it.
I think that's very well said, Angus. Sorry, Jeremy, too, but I just wanted to underline that. I couldn't agree more. And actually, we've seen in some other programs that we've supported that done really, really well at a local level. And I think it's great what Mark was saying about the sort of at the policy level, empowering places to actually develop the partnerships and the collaborations that they need, that are right for them in their areas and for their citizens. And the model, that collaborative model, might look very different in one place to another. But at policy level, we need to be okay with that. That's okay. Whoever coordinates that collaboration needs to be whichever organisation is the trusted organisation to do that in a particular area. So, it doesn't have to be led by housing or led by health or led by social care or indeed anybody else. It needs to be led by somebody. It just needs to be the right somebody for that particular area. And I'm sorry if that sounds a bit nebulous, but it's actually what's working. And I can show you in kind of some quite big programs that, you know, we've been involved in supporting where that's worked really well, and they're now demonstrating to others how to do it. So yeah, I couldn't agree more. It needs that sort of that collaborative, and I used the word in my opening remarks, humility. It does require some kind of agencies to step back and say, no, it's not, we're not the leaders, we're not sort of going to impose a top-down approach here. We need to make this work for everybody.
If I could just come in there as well, Jeremy, we in some of the conversations we had leading up to the development of the white paper, one of the messages that sort of really hit home for me is that actually the health and care sector and the social care sector is very good at innovating. Actually, there's endless examples, some really exciting work led by sort of charismatic individuals in very many cases. What's always, I think, the challenge is really embedding and sustaining that innovation. And there was a lovely expression coined by somebody in one of our workshops, pilotitis, like the disease of pilot work, you know. And what we would like to support places to do is kind of almost like the antidote to pilotitis, that, you know, how can you embed something in a way that's kind of inherently builds in the sustainability of it. And I think that is about risk and risk appetite, but I think it's importantly about the sort of relationship between, you know, commissioners and providers in particular, and how do we plan and strategize and commission in a way that firstly brings providers very closely to the table from the start, so that they're part of that sort of co-production with users and local residents as well, but builds a relationship in which providers, whether they're care and support providers, housing providers of digital solutions, they feel able to invest their time and energy, to take a risk as well, because they have this strong sense that in this place, yeah, people are in it for the long game. As I say, I don't think that's easy for local places to do when there are so many pressures on time and people and budgets, but certainly that embedding an antidote to pilotitis is something we're really keen to push with the funds that we're standing up.
Yeah, but I was going to also add to that, Mark, was that in terms of what you've described there, is that we need to blend this both in terms of the macro, thinking about the strategic vision or the ambition for that local economy, to the micro delivery, because there may be different outcomes that citizens, residents want in terms of improving their living standards. You know, whether it's some of the work that Sue touched on that, say, for example, Johnny Johnson Housing have done in terms of engaging with their sheltered housing residents to better understand what their needs are in terms of remodelling the accommodation, through some of the work that I know Welsh associations have done, where there's such poor digital connectivity, both geographically because of rurality of some, but also issues around digital poverty, you know, don't have a mobile phone, let alone have a phone. So again, you know, how do we ensure that we make sure there's an increasing education, as Sue said, but also how we raise awareness more as well. And I'll come back to that in a minute. You know, so I mean, Ian, you touched on some of the sort of benefits and sort of, you know, in terms of being able to support people in the system better. There's also supporting people who are self-carers as well, you know, people who are looking at different sort of market solutions to support them. And I'm just wondering whether, how do we encourage stakeholders to embrace technology in a far greater way? And I'm just wondering whether Mark or Sue or any of you had any thoughts on that. Anybody want to kick off?
Again, I can kick that one off if you want.
Please.
So Jeremy, you know, I think it's understanding the art of the possible. Technology is an absolute enabler to full service provision, and sort of when you certainly get into sort of the housing and people needing services perhaps later in life, technology needs to be seen as an enabler, not a blocker. But that then comes back to the whole education piece of making sure that somebody who's in the older generation actually understands how to use the technology, the outcomes it's going to support them with, and how it can be effective. But that then sort of, you need to build on sort of digital skills. But if you take my mother or my mother-in-law, both in their 80s, do you know what? When they get their phone, they're lethal. They understand exactly how to do it, probably better than my teenagers. You know, it's amazing what they can do with their online shopping or their online banking and so on. And you know, we mustn't. We need to make sure that they're enabled technologically, but you know what? They absolutely know how technology works, and we mustn't, you know, think that they don't. But we need to talk about outcomes. We need to talk about benefits, and that's both social for the citizen and financial for the authority. And many people on the call will often heard me talk about the citizen compared to the system, and where if you get it right for the citizen, the system absolutely benefits. So if you can keep people out of the frontline GP, if you can keep people out of secondary care, you keep people out of social care, and the system benefits as a result. And that starts with housing. It starts with getting it right and getting the right level of support at home where people are living. Because at the end of the day, who wants to be going to see the GP? Who wants to be going to clinics? Who wants to be going to hospitals if they can have that care at home? But I think it's also important to generate more real world evidence to support the rhetoric, making sure that what we're doing is evidenced and demonstrated that it works, because then when we're talking to commissioners and talking to the Marks of the world, you know, we can say, do you know what, we tried this and it worked, and this makes sense to do it this way. But it needs to be the right solution at the right time for the right person.
That's good. Do you have any views just building on that? I mean, you talked about the commissioners, but the other key ingredient here, and Sue sort of touched on it, is the role of carers themselves. And I'm just thinking whether, due to things like rising fuel prices, issues around fuel poverty, you know, whether we need to think about how we can support that new patterns of models of care and housing, I suppose, Mark, because actually it's more cost effective to doing it remotely, but still have that humility that Sue touched on, in a way that the person isn't sort of at a loss. Because yes, while they may be able to use Amazon and shop from Lidl online, many older adults, and I think Age UK are keen to look at this, aren't very good at shopping for care. Where do we go to? So I'm just wondering whether this sort of education piece is not just for the carers as essential, but also for citizens as well. I'm just thought, any comments from anybody on that?
Yeah, I'll have a go, Jeremy. You know, a big and difficult question. I'll just make a quick remark about evidence, because I think this is really important to bear in mind. And I've had a few conversations this week where I've tried to distinguish between the what and the how. What is it we want to deliver to people, or what is the problem we want to solve? What is the outcome we want to see? And then there's the how do we deliver that? And the how will always be, and should always be, different, varied, person-centered, and so on. But actually, to sort of paraphrase something Susan said about 20 minutes ago, there's an awful lot of agreement about the what we're all trying to achieve. And I think it's really helpful just to kind of keep that difference in our heads. And when it comes to evidence, I'm really keen that we're not just building the evidence of what works, but we're building the evidence of the how you do that as well. Not what this gadget is, or that gadget being better or worse than this competing gadget, but what are the practical steps you need to take to get it done in your place and to embed it in your place. So I'd just like to sort of lodge that what and how with people. And then I think to the point about supporting carers, whether those are unpaid carers or the care workforce, I think it's really interesting. You start to see some models and some innovations around the country where on the face of it, they are to support the workforce or to support carers, and the technology element might really be in the background. And as far as the end user is concerned, they might not even realise that there's an innovation, underpinning the care and support they're receiving. But it speaks to that innovation in the how you get stuff done, not just the innovation in the sparkly new iPhone you're holding in your hand. I'm not going to pretend that's a complete answer to your question, Jeremy, but some points I think are interesting.
Well, that's helpful. And also I see Sue's just posted something as well. Do you want to just explain what that is, Sue?
Yeah. It was actually just as I was thinking about that as you were talking, Mark. I think you've absolutely hit the nail on the head, and it's it was what I was saying. The difficult bit is the how, which is why it just always gets put on the too difficult pile, and because it involves, sadly, people and egos and tensions between interdepartmental budgets, etc. But I just wanted to highlight some work led by Professor John Glasby at the University of Birmingham that was funded by the ESRC and Health Foundation last year, that is actually now getting going with a number of what they're calling demonstrator sites across the UK that are trying to sort of scale and spread the sort of how to do things in adult social care in places that have actually got on and shown that they can be successful at it. So they've actually taken on, if you like, that really difficult job, and I think that's going to be interesting for us all to follow and for us all to observe.
Yeah, and equally, there's a really interesting project in parallel, actually, called the SASCI project, which is being led by the LSE, which also is looking to resurrect itself post-COVID, which I know the HousingLIN will be sort of sharing a bit more information about that at a later date. So watch out for that. But Angus, I think you've got your hand up again.
Yeah, just supporting is what Mark and Sue have said in terms of recommendations versus the how. So there's some great papers out there with loads and loads of fabulous recommendations that just sit there as recommendations. And for me, it's absolutely about the how. Perhaps think papers rather than white papers. The how we can deliver stuff in housing, health and social care, rather than just looking at a set of recommendations that just sit there and don't move forward. And picking up on the point about carers, and recently experienced this, for me it's about making things easy for carers. My mother-in-law is recently caring for my father-in-law, and everything in accessing health and social care services was hard work. So how can we make it easy? So almost like a tell us once service, rather than having to refer through multiple organisations, and stuff just happens as a result, rather than having to phone up and chase for something to actually happen. Because that would support her mother-in-law. It would mean that she's not as tired, she's more effective in her care and support for the one that she's looking after.
Yeah, that's really great, and thanks for grounding it back to that. I think that's really important. I'm conscious that this conversation is great. We've got some fantastic questions and you're contributing to the discussion, but can I please remind people who are listening and watching in, if you do have any questions, please do post them. We've had a few that are probably a bit more sales directed than sort of general policy or issues around research, but we've still got another 15 minutes or so, so please do don't feel shy in posting your questions. A couple of more that I thought about is about thinking about how do we support people at home, and I think Angus, you talked about sort of alternatives into residential care and hospital avoidance. As key as they are in terms of the health systems, what came through the digital plan was really what I really got a good sense of, and Mark, I think you sort of touched on this, was that it is actually about how to do system redesign to support people with at-home care and support, and so it could be triaged as appropriate. So I'm just thinking about whether you've got sort of issues around that prevention and that progressive prevention as well, Ian or Angus, in terms of that. And especially from the acute settings, and anything that you think might be needed in terms of what next or things to look out for over the next year or so?
I can kick off a bit. I think that sort of is maybe perhaps underutilized is the sort of digital health, telehealth, and things like remote patient monitoring. I think that's something we can make a lot more of in helping people, again, live independently, taking pressure off the GPs, taking pressure off the hospitals. If people are monitored at home, you know, they're taking an ownership and responsibility for their own health. It's making it easier for the GP, reducing, you know, home visits or visits to the surgery itself, reducing admissions to hospitals potentially. The advent of greater video consultations. I know it's more prevalent in the Nordics. I think in this country we can maybe learn something from that. So I think that's something that, you know, and I think with the data, things like predictive services, risk stratification, the better use of the data, more sharing. I think there's a lot of mileage in some of these avenues.
Just to add to that, Jeremy, I think for some authorities and housing providers, having good reactive services is fine. And they may not want to necessarily be proactive. Proactive is absolutely great, but in some instances, reactive is fine. However, to drive proactivity and proactive service delivery, you've got to have the appetite to do it in the first place. Because if you're going to say, well, I want to do it, but you have a half-hearted approach, then you're not going to realize the potential that being proactive and driving sort of system redesign can actually deliver. And that's sort of driving staff, its systems, its services, and, you know, thinking about how do I do things now compared to what outcomes do I want to achieve going forwards. And if you make it sort of outcomes and benefits focused, then you've got the end goal and the vision in mind. Is to then just becomes a question of how do I get from A to B as effectively and as quickly as possible. And it might be stopping and saying, you know what, this is how I do things now. I'm going to stop doing it that way and I'm going to start again. If I was going to go back to the beginning and redesign my service, how would I make it the best service possible? And then look at the gaps between it and say, okay, can I get to that brilliant service that I've just written down? Or is it outside of the scope? Or do I want to get there? What outcome do I want to achieve and how do I want to get there?
Oh, that's helpful. There's been a comment in the chat box, which is really about, you know, working not just with local authorities, but the wider NHS, like community pharmacies and the like. That's a really important point, Mark. Thanks for highlighting that. And there are other allied health professionals and those working right at the interface with social care and housing. So I'm just wondering, in terms of that sort of supporting people at home, were there any things coming through the commission that you talked about that Sky led on that might sort of you can put the finger on, which actually, I mean, you talked about some of the sort of the service of redesign, and you talked about a little bit about that sort of the vision. I was just wondering whether there are any practical things, if I could put you on the spot anyway, because I know from TAPPI and the TAPPI inquiry, we heard some really good sort of things that you know, sort of people supported with a learning disability, for example, who would automatically have been sort of referred to residential care or group living, but actually being able to support it to live well for much longer with other carers or at home independently, and come back to that independent choice and control that Mark talked about. So I just wonder if there's any parallels from the Sky Commission report.
Yeah, I think there are, but it's interesting, isn't it, that you know, you put me on the spot and asked me to sort of name some particular practical things. Actually, the issues are at the strategic level, and the things that we talked about there was that people don't have the sort of the range of choice in their localities of those sorts of different kinds of support. It's as you say, you know. You gave the learning disability example, but actually for older people, often, you know, they maybe have a fall, go into hospital, and the next thing they find themselves in a care home, which actually might be perfectly suitable for them much further down the line, but they only end up in that very high cost, high dependency kind of care because there's nothing else available. And so actually, and bringing it back to the subject of this conversation, if, you know, the house had been properly adapted earlier on, and, you know, they had access to some, you know, some degree of technology driven support, they could have avoided that sort of that immediate referral into the only option that was available. So, you know, this needs a much more strategic approach, which brings us right back to everybody involved getting around the table in a particular area and saying, what do we need? Let's develop our 10-year strategy and let's get on with that.
Yeah, and thanks for sort of highlighting adaptations, because as you were talking, a dear friend of the LIN, Dave Eldridge from Foundation, was talking about some of their work in London and issues that came coming through around adaptation and how they relate to fixtures and fittings. So, you know, it's not just the tech, but it's also, you know, door openers, window blinds, he touches
Absolutely.
on, you know, and other communication. And I know Lauren Walker's been with us this afternoon from the Royal College of Occupational Therapy, and some of the work they've done around adaptations without delay to look at speedier interventions. And I'm just thinking on that interventions, perhaps this is a question for you, Angus, how can we be more proactive and more predictive in relation to that?
So I think, Jeremy, it's you know, a lot of this is about understanding the citizen needs. It's about making sure that the assessment is right in the first place, and getting the right service in place for the citizen. And then sort of we need to, the more we become proactive and predictive through the use of gathering data and information, the better decisions we can make. So it's about, we can collect an awful lot of data at the moment, but then it becomes about what do we do with that data and that information? How do we use it effectively to improve decision making? Now, if you think about the information that Tesco or Lloyds Bank or Barclays or whoever you bank with, all the information they've got on me, do you know what? I would, who knows what they've got on me? But it's an awful lot of stuff that I can find out if I really want to, but am I ever going to find out? Probably not. But when it comes to housing, health and social care, where I don't want you to have my information because you might want to start monitoring me. And you think, well, really? But that then becomes, how do we then use that data to be more effective to improve decision making for social care, health and housing services, to make sure that the solutions that get put in are the right solutions. So for me, it's about understanding needs. It's about top-down leadership, but also listening to those that are sort of on the ground and talking to people on a day-to-day basis, because that is where a lot of the information or a lot of the challenges that people face comes from. It's through the conversations, the face-to-face. Do you know what? I'm struggling with this. Well, okay, well, let's take that away. Think about what we can do, because if Jeremy's struggling with it, chances are that Ian, Mark, Sue, and Angus could be struggling with it as well. So actually, let's listen to people. Let's work together again, coming back to that collaboration, to make sure that services and solutions that we are developing and implementing are the right ones for the citizens that we serve.
That's interesting, because I think what has come through perhaps over the last 2 or 3 years, especially with some of the necessary interventions on the one hand through COVID, you know, the emphasis on both hospitalisation of people, but also where people have moved to care homes or indeed other forms of specialist housing. It's been often, I think you touched on, it's been a tablet-led response, not a user-led response, because let's chuck a tablet at the situation. Actually, we need to think about how to make sure we've got the right information. And again, this comes back to the co-production as well. You know, we're engaging right at the outset to try and understand what those patterns are, determined about the types of lifestyles and aspirations that the individuals have. Any other thoughts about proactive and predictive measures? Oh, Mark, you've got your hand up. Sorry, I missed that.
Yeah, thanks, Jeremy. I just I'll do a bit of a plug for some of the digital and tech elements that are in the white paper and the new digital plan for health and social care. I put the links to in the chat earlier. Colleagues are leading on this work, so I won't pretend an enormous amount of detail, but I think it is helpful just to sort of remind ourselves actually that there's some pretty big investments in the white paper about digital skills for the social care workforce, about getting high-speed broadband into care homes, which does sort of remind us a little bit that, you know, we're not all lucky enough to be sitting in a house in southwest London with Wi-Fi on tap and 2 mobile phones around me and something and Bluetooth in the corner, and you know that there's some foundational sort of software infrastructure that still needs building. I think that's kind of important to remember. And you know, some of the other commitments that are around things like you know, shared health and care records, and some of the sort of investment going into what are priority what's that we've identified, like falls prevention. I must say, Jeremy, I like the phrase tablet-led response. I shall borrow that and use that and pass it off as if it was my own. And it sort of reminds me to say that the Disabled Facilities Grant, which, you know, enormously useful policy intervention, 50,000 people a year benefit from that in some way. I think I'm right in saying about 3/4 of the money goes towards stair lifts and ramps and showers. And I think that's a really important reminder, because with the best will of the world, I can't have a shower with my iPhone. And I think it's a really important reminder that it starts with the need of the user. And in a sense, some things never go out of fashion. Thanks, Dave. That's a more accurate statistic.
He's validated that already. Thanks, Dave. Yeah, that's a really good point. Look, I'm conscious that I think we've had a question come in. I'm just going to have a quick look. Yeah, Holly's asking how many tech solutions are available to those with a sensory impairment. This seems to be a challenge for many, and I think for me, Holly, there's an issue around inclusivity here. We need to think inclusive design of all our systems. But I think Sue, you had a point you wanted to raise about where Dunhill are going on this as well.
Yeah, it's something that we've long recognised, and it's really interesting. Whenever we've had calls for research and evidence on, and particularly on hearing loss, which the vast majority of us are going to experience to some extent, and is extremely socially isolating, and is actually now being shown to be, you know, a key cause of dementia. That actually there is so little work going on in supporting hearing loss in particular. Sight loss to a lesser extent, there seems to be more going on there. But yeah, we're going to be launching a call for proposals on that at some point, probably later on this year. But there are extraordinarily few people working on it. And I can completely agree. And given it's something, as I said, that's going to affect probably more than 3/4 of us as we get older, it really needs a lot more attention, both at the sort of technology intervention level, but actually also at the service level. It seems to very much be the Cinderella service of our health and social care service.
Sue, possibly with your extensive networks in sort of things like neuro rehab and other elements, there may be other aspects which link to
that actually all linked together. Exactly.
Yeah,
no,
yeah,
completely
so,
agree. Which is, as I say, it's kind of the next of our missions.
Yeah, well, we look forward to linking in some way with you on the housing front on that. So you made the point earlier, and in fact, this is a question to all of you about, you know, how do we raise awareness and educate? And the final question I have, really, which from me, is, you know, how do we capitalize on this, on the value of this kind of technology, and increase awareness, not just to a professional audience, many of us joining us this afternoon are, but actually to the citizens and users of services as well. And I say so at a time when TSA have launched the Tech Alliance, which with ELAP as well. So again, you know, the LIN's pleased to be part of that. So any thoughts from any of you around that sort of awareness, education, to build on what Sue was saying earlier?
Just very briefly, and I'm sure others will want to build on this, but Angus touched on it earlier. It's not about the technology, it's about the outcome, isn't it? It's about how it's going to make a difference, and it's making sure that in all of our communications, it's that we're talking about. So as not to put people off, that it's something that is somehow something that they don't understand and is inaccessible to them, but to demonstrate how it's really going to make their lives better and make a difference for them. I don't think it's any more difficult than that, but I just think it has to be on the agenda, a bit like it has to be on the agenda in all education and training, as we talked about earlier, across the board. We need to just keep talking about it and keeping it there on the agenda. It has to be there in the tick list whenever we're planning programs or any kind of communication.
And to add to that, Jeremy, I think it's about, and we've talked about it already, it's about multiple stakeholder buy-in. It's about organisations working together to provide the best solutions for users. So that might be social care, it might be the fire service, it might be the voluntary sector, it might be charities, but actually let's not work in isolation, let's work together to provide the best solution for the citizen.
Yeah, no, absolutely. Any final thoughts from you, Ian? And then I'll come to Mark.
Yeah, I just and there's a question in the chat. I recall a visit I made recently to housing and social care team at South Gloucester, and we met in a house that was just purely for the OT team. It was all of the kind of window closers, stair lifts, adapted cooking facilities, shower, the digital tech, and they could bring people to the house and demonstrate an enormous array, not just the tech equipment, but all of the sort of assistive technology that is available, from the showers to digital, and to help demystify it for the public and potential new users of the array. And maybe just a shout out to South Gloucester in what's a very innovative idea in helping raise awareness about what is possible and how people can live better independently with the enormous array of things that are on offer. So just like to add that.
Of course, South Gloucestershire, I think, has also got the partnership with the University of West of England in Bristol around looking at robotics as well. So looking beyond the current state of play in terms of our home environment, we're also thinking our future. Mark, any final thoughts from you?
Well, just one remark, really, Jeremy, that I kind of make as a sort of an ordinary citizen, rather than pretending it's an expert opinion at all, which I think there's something about people's expectations and assumptions, and basically what we see our friends and relatives have. I think that's really, really important. That if we see friends and family members, next door neighbours, people in our community who've got a great new solution that helps them do X, I think that's probably the most powerful advert. That's the right word, isn't it? I think that's probably the most powerful advert.
Making it aspirational, I think, is that thing as well. I mean, we've talked in other fora as well about some of these housing adaptations that just look medical. Don't they need to look stylish? So they need to not look like they're there to assist somebody who's got a problem. They need to be, so it's aspirational, stylish, like you say. Everybody's got, everybody has this. I think, yeah, I agree.
No, that's great. So, and Ian, I think you said the scheme you were talking about, the project is in Yate, which is in South Gloucestershire, sort of. No, that's great. Look, one of the things I'm conscious of, and one of the things that came out of a round table at the CIH annual conference last week, was the language and the complexity and the understanding of the language, especially amongst older adults. They struggle to understand what extra care housing is, let alone what telecare, etc. is. So again, we need to think about how we make it plain and simple and easily understandable, and as a result, identifiable. I'm conscious that my 93-year-old father very rarely now emails me, whereas it's always on the phone, whereas perhaps until 2 years ago, he was regularly pinging me things. Again, manual dexterity, all those sort of things just demonstrate how some people slow down and find technology one step too far. Now, there are other things artificially as well that Angus has touched on and Ian will know about, that may best provide him with a better solution. But as I think all of you said, we need to work from the person first and then outwardly about how we take that forward. Look, we've hit 5:15. We're bang on time. Thanks everybody for your questions and the comments in the chat. We will be posting those and sharing with those along with the presentations and the recording of this happy hour session tomorrow. If you've missed it, if you know people who've missed it, please do forward the link on. It will also featured in our weekly bulletin links on Friday. Can I give a big thanks to everybody who's contributed and giving up their time to present this afternoon. And I was going to say, and particularly Sue, who I know is struggling with COVID, but it's great that we're able to do this virtually, because it would have been impossible to have done it in person. Can I thank Tunstall and the team, Angus and Ian, for your support for making this session possible, and Mark for your excellent contributions as well. And the HousingLIN team behind the scenes, Sally and Jerome, for helping us put this on and running it so smoothly. My internet was definitely dipping in and out this afternoon, so apologies if the sound quality has been poor. Before I leave you, just to say, if this is the first time you've joined a HousingLIN happy hour session, we run them weekly or sometimes every other week. In fact, we have another one next week, which is based on two universities. We're doing work, another Cambridge University project looking at downsizing and work in Hackney among social housing tenants on the Woodbury Downs estate and what the options are in Hackney, and it's part of the regeneration project. And a really interesting piece on right placing, building on the right sizing sort of work that Greater Manchester has done with the Centre for Ageing Better. And coming back to that issue that Sue touched on about stylish and contemporary design, we're working with Motion Spot and an interior designer to bring you a really interesting session on interiors and design, on designing for inclusion on the 26th of July. So we have 2 more happy hour sessions in this part of the series. Please do join us if you're interested in either of those, and do follow us. But on behalf of the HousingLIN, the speakers, and our sponsor this afternoon, Tunstall Healthcare, thank you very much for your time, and have a pleasant evening.
Thanks, everyone.